He first became interested in dinosaurs probably about 1.5 years ago. One of his favorite people is Nigel Marvin, who's actually a zoologist and adventurer who did these videos where he went back in time and spent time with the dinosaurs. And that's where Oliver's learned a lot about dinosaurs, is by watching him. And so that's why he says that instead of something being a crocodile, it's a sarcosuchus, or instead of it being a great white, it's a megalodon, because he wants them to be the animals that Nigel sees. And he often dresses up as Nigel too. Well, when I was younger, my mother used to always make birthday cakes for us. I remember for 1 year she made my brother an actual fort with soldiers in it, and she used to always make, I had little houses, and she would use different chocolate bars to make the roof, and I always loved those cakes. And so when I was in medical school, I took a cake decorating class at one of the local stores. It's definitely different making cakes with Oliver than by myself. I definitely have to be more patient and realize that it's probably not going to turn out exactly as I wanted it to, but that's okay because he's enjoying it. I decided I wanted to be a doctor when I was about 12 years old. I had read a book about a heart surgeon, and she was one of the first female heart surgeons, and I was inspired by her and wanted to be just like her. So I entered med school thinking I was going to be a heart surgeon, and while I was there, you do different electives, and I kind of came to see that the patients that I would have, being an obstetrician gynecologist, were much more in line with what I wanted to do. I wanted to be able to have a relationship with someone throughout the course of their life and be involved in some really important parts of their lives, which is having kids. It's really nice when you actually get to know someone and you get to know who they are outside of the half an hour that you spend with them in clinic, so you know about their family and you know what their job is and what they do outside of the 30 minutes that you're seeing them. It's nice being able to create relationships with your patients. And when you see them at the store, they know who you are and you know who they are. So I don't go to the grocery store in my pajamas. I think that everything in someone's life impacts their health. I think there's a huge role that diet and exercise play in how someone feels. Just in terms of myself, I know when I exercise regularly, I feel much better, and when I don't find the time to do it, I definitely hurt more and ache more and have less energy. So I think that everything about how one conducts one's life impacts their health, in terms of their stress, in terms of how they eat, in terms of exercise, in terms of how they relate to other people and their family and their friends. I think the important thing about baking is to know that it's okay to bake, and it's okay to eat cake, just in moderation. You know, if you eat cake every now and then, it's not a big deal. It's just you can't eat a large piece every day. I'm Analene Pentopoulos, and I'm an obstetrician gynecologist.